Are you able to tell me about the main changes proposed to the detention criteria through the mental health bill?
Certainly. So there are a number of changes that are to be made to the detention criteria under the bill. Some of the main changes, firstly, include the threshold for detention. So under clause 5 of the mental health bill at the moment, changes are made to the threshold for detention for sections 2, 3, 5, and also for renewals of detention under section 20. In relation to that threshold, it's going to introduce a serious harm test. And the reason for that is to try and make sure that the detention of people is only happening where it absolutely has to happen, as the least restrictive option for that individual. So the bill at the moment is going to introduce changes to Part 2 in terms of those thresholds, but is largely not going to be brought in relation to Part 3, which are the forensic sections of the Mental Health Act for those that come into the system under the criminal justice system. Those are largely remaining unchanged. However, there are some implications from Section 20 renewals for those that are unrestricted Part 3 patients, such as those on a Section 37 without restrictions. The serious harm is not defined in the bill at the moment. That will come through the Code of Practice in time, and will likely develop in case law as well in relation to what that threshold is. There's also an issue about the likelihood of that serious harm. That's going to be something which is different for practitioners to get used to in assessing what that likelihood is. And that's again to make sure that people are only detained where it's absolutely necessary. Another factor that's going to change is the appropriate treatment element of detention. It's bringing forward really the definition about appropriate treatment that was in section 145 of the Act to being in a new section 1A right on the face of the new detention criteria, to bring it to the forefront of people's minds that appropriate medical treatment needs to have a therapeutic benefit. And finally, another really significant change is in relation to learning disability and autism, in that there are changes to Part 2 of the Act, in that anyone who is looking to be detained under Section 3 who has a learning disability or autism must also have a co-occurring mental health disorder.
What impact might the changes relating to learning disability and autism have?
In relation to Part 2 patients, for those detained under Section 2, there isn't the necessity to have a co-occurring mental health disorder in relation to learning disability and autism. That remains as it is at the moment in relation to those kind of criteria for detention. And part of the reason for that is you may need to assess for a co-occurring psychiatric disorder. For those under Section 3, though, you will need that co-occurring mental health condition. And that really may impact those that are in crisis in the community who have a breakdown in package, for example, where hospital is often used as a crisis mechanism at the moment. That won't be possible when the changes come in to Section 3. Part 3 of the Act is unaffected in the sense of there not needing to be that co-occurring mental health condition alongside learning disability or autism. You can still be detained under that part of the Act. And CTOs won't be able to be made for those who have a learning disability or autism without a co-occurring mental health condition.
So how will the changes to the criteria impact on providers and commissioners, and do you have any tips on how that could be managed?
Yes, there's going to be a lot of change, so certainly training is a really important factor for both providers and commissioners to think about at an early stage. We know that some professional organisations are really concerned about the changes to detention criteria. For example, psychiatrists, how will they assess this likelihood of serious harm at a point of initial detention when there might not be as much information available to them as once they've actually undergone a period of assessment? There is also a concern about that there's already issues within A&E departments, for example, which are having to take up the difficult situation around bed availability that's happening across the country. There are limitations on the number of health-based places of safety, and that's leading to people having to sometimes wait in A&E for long periods of time. And at the moment, community mental health services can't necessarily manage the robust nature of that support that's required, and there's also limitations around the legal frameworks around that whilst waiting for beds. So those issues are already live issues, and this increase in the threshold for detention criteria may lead to greater concerns on the ground about how community services are able to manage that. In relation to learning disability and autism in particular, those that are already under what was known as the Transforming Care programme and is now building the right support for people in relation to that, that is a real problem that is already delayed discharges across the country because of a lack of suitable community homes. And also those that go into crisis, how will they be managed? And there really needs to be robust joined up working between partner agencies to be able to help support both practitioners on the ground and those who have a mental health crisis in being able to cope with these new changes. And training is going to be really key in that.
That's been really helpful and informative. Thank you, Louise.
Thank you very much.